What is the coronavirus? Coronavirus may be a family of viruses, a number of which may infect people and animals, named for crown-like spikes on their surfaces. Fast facts: new coronavirus and COVID-19. COVID-19 is the first pandemic since the 2009 swine influenza H1N1 pandemic. Unlike COVID-19, H1N1 mostly affected children and young adults. The number of individuals experiencing acute hunger is predicted to double in 2020 to 265 million due to the coronavirus pandemic. 5 billion students, 87% of the worldwide student population, were out of faculty at the top of March due to the new coronavirus. Over 3 months of quarantine, global cases of violence and abuse are expected to extend by 20%, consistent with the UN Population Fund. How am I able to help people made more vulnerable by the new coronavirus? The coronavirus pandemic, like earlier epidemics of Zika and Ebola, is causing illness and death in many nations. Where children are left without adequate care and support, they'll be forced into desperate situations, including throwing in the towel of faculty and resorting to working, begging, or other exploitative situations to survive. You'll help people made more vulnerable by the new coronavirus. What are the symptoms of COVID-19? Symptoms of COVID-19 include respiratory disease with fever, cough, and difficulty breathing. Sometimes people experience chills and shaking, muscle pain, headache, pharyngitis, or a replacement loss of sense of taste or smell. In severe cases, COVID-19 can cause pneumonia and severe acute respiratory syndrome. People with chronic health conditions and therefore the elderly are more likely than others to possess a life-threatening case of the disease. Pray, Lord, we come to you to intercede for your precious children suffering from the new coronavirus disease. Guide scientists and doctors in developing a vaccine, and convey comfort and healing to people that are suffering. We ask that you simply also fill with peace all the relations and friends of individuals affected. Your donation to World Vision will help to limit the spread of COVID-19 and reduce its impact on vulnerable children and their families within the U.S. and abroad. How am I able to prevent getting the new coronavirus? The World Health Organization has the subsequent recommendations for the overall public to scale back exposure to and transmission of a variety of illnesses, including the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub or soap and water. Learn the way to wash your hands properly. Practice physical distancing, formerly social distancing. Here's why: by limiting some time publicly places to essential trips, staying a minimum of 6 feet from people, and not greeting others with a handshake or other touch. When coughing and sneezing, cover your mouth and nose with a flexed elbow or tissue. Then throw the tissue away immediately and wash your hands. Avoid close contact with anyone who features a fever and cough. If you've got a fever, cough, and difficulty breathing, seek medical aid early and share your travel history together with your healthcare provider. Avoid the consumption of raw or undercooked animal products. Handle meat, milk, and animal organs with care to avoid cross-contamination with uncooked foods, per good food safety practices.